So I think we can get started. I wanted to welcome and thank everyone for coming. My name is Mike Nagayama, channel manager here at Fudo Security, and on behalf of Fudo, as well as our reseller partner, aXcelerate Networks. Again, thank you all for coming. And without further ado, I will pass it off to Sasha, who can get started in showing us a little bit more about secure remote access in the healthcare industry. Sasha, take it away.
Okay, hello and welcome everyone. I believe it is time to begin today's webinar. So thanks for joining us today here. I see quite a few of you here from around the world. So wherever you are, thanks for joining us here on our Fudo Security webinar and why healthcare needs a PAM solution. My name is Sasha Farbach. I'll be one of your hosts today. I'm a cybersecurity evangelist here at Fudo Security. And then running with the session with me is my colleague, Rafal Vyosna, our pre-sales engineer here at Fudo Security.
Hello.
Just a few housekeeping rules at the moment. You as a participant are muted. So if you have any questions, please do save them until the end. We'll have time for that when we conclude everything. So let's crack on with today's agenda. So it's going to be a brief intro about Fudo Security and also the kind of the state of healthcare and cyber threats. So it's very much geared towards this vertical today. Then we'll be going through some more details about the operational efficiency and control, essentially how global healthcare organizations and hospitals can benefit from a complete overview of privileged access and users. Then we'll also look at some use cases on how Fudo PAM is going to help organizations mitigate threats within the healthcare and clinical environment. So that'll also be a chance for you to see the demo, which will be run by my colleague, Rafal. So it'll give you a real insight into our solution, what that looks like in practice. Right, so real briefly about us, Fudo Security, and we are a leader, a PAM leader, globally present with a partner network of over 100 partners around the world. Continuing to grow. Last year, around 70% year-on-year growth between 2019 and 2020. We've been recognized by Gartner and KuppingerCole for our efforts, and actually just recently, another award by Cybersecurity Excellence in the United States. Also are trusted by customers in many verticals as a PAM vendor. You'll see that we are actually well known across many verticals from banking, healthcare, government, transportation, education, energy, and many others. And you might recognize some of those clients here in front of you now, really spanning the globe. So we've been in the field for a while now and continue to compete against rather large players and ourselves, establishing with our solution with Fudo PAM as being something that we're very proud of, and that you'll see in action here today and how it applies to the healthcare industry. Right, so let's jump right into today's main patient, if you will, the challenging reality, pardon the pun, of healthcare. And of course, you see this across the board. I mean, we live in a time, especially now with COVID-19, the situation has been exacerbated, that healthcare continues to suffer quite a lot, and this is one of the prime suspects in all the reports. It's been, healthcare is a fascinating field because it has been changing over the last decades. I mean, it's actually incredibly transformational. It continues to evolve at a very rapid pace. We see a lot of new and interesting things. We see a lot of new adoption of technology. We've witnessed and experiencing more of a digitization of healthcare data. But also with that, we see pushing demand of data sharing, of that data access. We see a very diverse user profile. We see various types of people across a variety of locations collaborating, working together. So we can kind of see that there is this pain point. And with that comes many access challenges. If we're looking at a diverse infrastructure of clinics and hospitals, and then extend that by other third-party providers that are maybe connected to insurance or healthcare systems, and we're looking also at legacy applications and various levels of access. And there's a real wide spectrum of very complicated means where we need to make sure we know what's going on. So essentially, also what I want to mention here is that one of the first sort of real problem areas from just 2019 was this massive data breach with AMCA in the United States, which affected 25 million patients and their data. So that's quite significant. I mentioned third party and insurers because that's something as well. I mean, this is a major case also back in 2019. I think it was Dominion National Insurance. Basically, they and this also highlights one of the problems is that this massive organization with so much access to patient data, they were hacked on their servers, and they didn't report it for over 9 years. So this potentially had a huge vulnerability out there for then access of insiders and external users looking in there and getting all that patient data. So it was only through an internal alert that revealed this unauthorized access on its systems, which then promoted all the reaction and prompted that investigation. And they found unauthorized access going back years. So it is unfortunately a matter of worry that much of this breach time tends to be several months or sometimes several years. And also, like as I said here, in Europe, the number is slightly, let's say, rather more optimistic, if you will. Just the recent study by ENISA, the EU cybersecurity agency, last year pretty much found that the average breach detection time is around 6 months. But it is always a case of now, how did this bad actor get access, right? It's always the same. It always boils down to compromised accounts. I'll have more on that a little bit later. There's some interesting data, a little bit worrying data as well. So yeah, also to recap with a little bit of the state of play at the moment with healthcare, looking at around 58% of healthcare patient data breaches are caused by insiders. So we still see a significant portion actually of a lot of the troubles coming from the inside. And if you imagine like a healthcare environment, looking at just all the admins, all the staff, all the doctors, technicians, and then you extrapolate that into various locations, and also just the push of the demand and the urgency of access as well. Mind you, I mean, in some cases with healthcare, it's a matter of life and death that access has to be given, data has to be shared, collaborated, be that X-rays or certain blood results or payment systems. So you have this incredible urgency, which is also an incredible challenge. So it's no wonder then that insiders are still a major problem, unfortunately. Also, healthcare, unfortunately, the news is that it's getting worse. We've seen also from last year and this year, this is from data from the offices of Health and Human Services in the United States, that we had a 25% rise in year-over-year healthcare data breaches. So it's just growing. And then we look at just last year, 29 million healthcare records breached in the United States alone. This is a similar pattern we can see in other parts of the world. And healthcare is just an area that hackers and insiders flock to for all that patient data that's there. And one thing that's also worrying is that within the organization, that's why insiders are such a worry, is that an Accenture survey found that 1 in 5 healthcare staff, so that's about like roughly around 20%, are willing to sell the confidential data. So you have healthcare staff in many cases, which are also trained in many cases about cybersecurity and data security, and they're still willing to share that access. You might be wondering, well, they're going to do it for a lot of money, but actually the average that they're willing to actually take for that sort of sharing that data and selling it is about $500. So that's why you can see that from, with all the different access points, the million access points, really, we see that there's points of access and attack surfaces, and really the tough exposure, which can be really detrimental, and in some cases, I don't want to be melodramatic here, but can be deadly. So there's actually a case last year in Germany which was pretty much, this is debatable, but this is very much still showed that a ransomware attack, which actually prompted the shutdown of a hospital, and emergency services arrived with a patient. That patient was not able to be treated. Then it was moved to another hospital. This woman was moved many, many kilometers away. Then by that time, the condition deteriorated to such a point that this woman actually died. So there's a debate currently in Germany and in Europe, and I think in the info and medical security world. Was this the first death caused by a cyber attack? And some people say it is. Some say that this would have happened anyway. But nevertheless, it is a worrying signal that you now have people's lives really hanging in the balance by cybersecurity. Right. Okay, so looking at more of the need, if we have this massive organization as healthcare, various stakeholders looking at various access points, we need to secure those privileged access accounts. That's vital. This is something that is going to be required. We need to make sure, we're looking at different types of access, but it's those privileged accounts, those root accounts, those admin accounts that are really, really vital. They need to be secured. We also have the added element of compliance. And we have more and more compliance. We have GDPR in Europe. There's HIPAA in the United States. There's further regulation on a state level from the California data protection law, now also in Virginia, and probably more states will have this as well. India has its own set of new regulations now, I think, coming out. Brazil is the same. There are many nations around the world where compliance is becoming a bigger thing and more intense thing, and we'll see that probably just continue in the next year and beyond. Further, we have to ensure that we see all this expansion of healthcare data. More and more files, more and more details. Everything needs to be stored securely. So how do we do that? That's also a vital point. We need to make sure that we understand, that we guide and we secure all the different types of healthcare data users, as I said, from the doctors to the technicians to the third parties that have access, the legacy system users, the healthcare systems like Epic, managing different caseloads. So this is also something that needs to be taken care of in a proper and holistic way. And overall, we need to improve and optimize all of this in a consistent way to make sure that hospital workflow and access is then secured. So there's plenty of need for making sure that this very complex system, this very complex organization, this vital system in our society is secured the proper way. So there's more reasons than I can count to establish that healthcare needs a PAM solution. So I just want to go through some of the actual clients that we have, notably in the DACH region, so Germany, Austria, and Switzerland, that actually have decided to take this very seriously and have employed and utilized Fudo PAM. So I just want to also show you that these are top-notch level healthcare providers and clinics that realize that this is something they need, this is something that is required. So first one I just want to show off very briefly is St. Joseph's Hospital in the city of Wiesbaden. Now, Wiesbaden, you may or may not have heard of it, is one of the top 5 cities in Germany, one of the wealthiest cities. A lot of people living there, connected to finance, connected to various things. It's close to Frankfurt, so there's a lot of high level, people who live in this place, and it sees a lot of wealth. So obviously, with that comes the idea of pushing the highest standards, not just what people demand from the cities around them, but obviously what is then given to them. And that in healthcare, of course, needs to be at the highest standard. So therefore, their health security, their data security at the highest level. The hospital itself goes back to 1876. A range of medical departments, numbering I think over 12 of them, 30,000 patient cases annually, well over 1,000 staff. And judging from our conversations with them, how they've reported of using Fudo, using Fudo PAM, it's very much about having a complete oversight of various new contractors that come in, various new changing of staff that come in, or just contractors are connecting from around the city or other parts of the country to service different accounts and do their work, which is required. It's very much that they have seen the benefit of their workflow increasing, that their processes are better. They had various systems before. It was a mess, and now everything is in one central and secured location. It's benefited how their staff work, not just internally with their clinical staff, but externally. So they have told us very much in great detail how this is something that services them directly, and they're very happy about that. In a similar case, I want to now look at Vivantes, which is also in Germany. In fact, it is Germany's largest public health network, which has been using the Fudo PAM for a number of years. Various clinics and hospitals based in Berlin. So we're looking at over 15,000 staff, also almost 500,000 patients per year. So very busy, very high demand environment. And again, they look at the highest levels, what they need, and they need a PAM solution. They chose Fudo for that. So again, what are they benefiting from? Third-party contractor activity that's recorded, all the different sessions, all the different keystrokes, all the different files that are then accessed and changed. So this is something vital to them. And if we're looking at 15,000 staff at hundreds of thousands of patients, I mean, this needs to be efficient. So again, they've said very much that, and the doctors have said that the sensitive patient data that they use, have access to, and are in touch with all the time is secure. And again, very similar like St. Joseph, that work is now seamless, that efficiency overall has improved. If you're looking at different access points, we need to make sure that things are organized. We need to make sure that things can be audited. And again, I need to mention GDPR here. There's a very vital component here in Europe, and all different types of organizations, especially the healthcare industry, take that very seriously. Another case from Switzerland. We know Switzerland's healthcare system is one of the top in the world, in the top 10. This particular institution has over 1,200 doctors and staff. Again, a huge capacity for patients, over 10,000. And also what's interesting here is they have a variety of different types of people who are working within the clinic, 45 different job branches, looking not just at maybe just the medical area, but also in terms of, looking at maintenance and different types of services that all cluster together to make, function clinic possible. And again, they've said to us very directly, it is about maintaining IT and audit compliance with GDPR. Again, this is only going to mirror many other organizations that use this. Also, one thing that they've pointed out is that they're able to avoid misuse of credentials, and that being, as I said earlier, one of the main culprits of insiders, and that still being that most people on the inside misconfigured, wrongful access. This is still a huge problem, which leads to a lot of headache and serious issues in the healthcare industry. So this is something that they've pointed to us as being a major benefit of using a PAM solution. And again, they know that they can now confidently not only offer the best healthcare to their patients, but also that healthcare is changing in the sense of not just the health environment of the patient, but also then that data security, that data health care, if you will. So that is that new way that we're going forward, and that's something that they're very happy about. Right. So, in generally, things on how we've done them in the past and what is the best way to keep secure. Some healthcare providers may say, well, we already have something like a VPN, and actually talked to some of these clients that I've shown you earlier, even something as basic as TeamViewer. Obviously, which is not efficient and not sufficient in many, many ways. So again, with the VPN, very much also with according to Gartner, that VPN is on its way out, and that we're going towards a more serious approach with zero trust. So again, the VPN is just not sufficient for the needs, especially not scalable, especially not enough for the kinds of complete holistic security that you need. And with that access recording which you'll see, and that session recording that you will see, that's just not that just falls short. Some people say, okay, with MFA, that's an excellent way of having security, of making sure that things are, more or less controlled. But again, it's not enough. You don't see what's very much behind the door. You see very much what's in front of the door. And this is just not sufficient if you're looking at the kind of plethora and detail of what's going to happen with these sessions and what are contractors accessing. So again, not really enough. Password Vault, again, more or less, again, covering what's in front of the door and not behind the door. Great way to begin. And I think no one can offer you complete security, but certainly these leave vast gaps in your protection. So that's why these things are great, but they're not sufficient and they have their limitations. And that's why we very much believe, and these clinics have very much believed and trust us and have come to the realization that the only way forward to making sure and making a dent and also mitigating threats is through a privilege access management solution. Fudo, that's what it is. It is very much like a security camera for your privileged sessions. It's very much about recording everything. You're able to have oversight and see who, what, where, how. You're able to see all the raw data, and you will see very much that this is like a CCTV camera inside your data infrastructure, looking around in every direction, 24/7, 365 days a week. So this is something that nothing gets by. Everything is recorded, and that will be shown a little bit more by my colleague in a moment. So I'm going to, at this point, pass on to Rafael, who'll go into the details of how FudoPAM works and how it's deployed. Rafael?
Okay, I will present 3 use cases that will show how FudoPAM will be able to help you take control of the connections by your employees, by your contractors, or just archive administrative actions in your infrastructure. Now, let's suppose you run a web-based patients record management system. Maybe you're bound by the laws such as GDPR or HIPAA, thus you care about who had access to your patient's data and when. Without FudoPAM, you had to rely on web servers logs or application logs to make a record of user actions, but this is kind of dry data that does not tell you much about what happened. And you even have to get everything configured right to get the information on who was accessing the system. FudoPAM can help you centralize access rights for your employees and contractors in one easily manageable system, and it works with web-based applications out of the box without the need for a jump host. If you happen to run everything in Windows server-based infrastructure, this can save you from buying extra client access licenses. Let's take a look on how a doctor can run a session through Fudo. I'm navigating to Fudo's user access gateway page, a kind of portal site for the users. Let's type in a classic login and password here. Okay, now Fudo asks me for a one-time token, which is an extra step that augments access security. With Fudo, it's easy to add a second factor for the user authentication, and it's a good practice to leverage this function. So I'm reaching for my phone to type in the 6 digits one-time code that Google Authenticator shows me. Okay, I'm done, and now I'm authenticated. As you can see, Fudo's administrator gave me a permit to connect to a server and patient's record system. So let's try the later one and show you how the session goes. I'm logging into this web page, but with Fudo you can easily create an auto-login procedure for any web-based systems that's saving the user from entering the credentials here. Okay, let's look at Mr. Blofeld's record. We have one session running, so let's open it and see what is going on. I will try to show you that this session view is live and real time. So let's put the windows side by side and you will see the action live. As you can see, Fudo is recording the session, thus archiving any kind of activity regarding access to patient's records management. While the session is live and recorded, we can search for previous sessions where Mr. Blofeld's data was accessed. I'll just type the patient's name in the search bar here, and Fudo will find every session which has Mr. Blofeld's name shown on the screen or typed in. So here's one. We can take a look at who was looking at this patient's record and when. To view this session, all I need is to press the play button and a new window with this session's playback will pop up. This functionality uses Fudo's built-in OCR feature, which will recognize all the words shown on the screen and make it searchable through the archive of sessions stored in Fudo. And this is great for compliance or auditing. You can have compelling evidence of your user's activity, not just dry log entries. To summarize this section, Fudo's innovative approach to recording web sessions makes it a great tool to monitor and audit all the activity related to the data, however sensitive, including the actual recordings of the sessions. And if your system does not use the encrypted HTTPS channel as it is in this example, it's trivial to implement it and secure access to your data without the need to reconfigure the actual patient's data management application. As for the second use case, I will show how Fudo PAM can help you to create a workflow for the contractors to access your systems for maintenance or configuration and how you can achieve tighter control over the process. One of the killer new features in Fudo 5.0 is the ability to set up a complete workflow for creating and maintaining access rights dynamically. With this feature, you can give just-in-time access to a system you rely on for daily operations to a person or a company responsible for maintaining it. Sounds simple, right? Let me assure you, the implementation is not easy when you try to make it agile. Not overcomplicated nor oversimplified. But you might ask, what is just-in-time access? Well, it's the control that Fudo 5.0 provides the security officer to make the session available to the contractor only when the person is permitted to run it. To run a session, the contractor needs permission from one or more people responsible for granting such access. The configuration is there, but before even the session can be started, someone needs to say, I'm okay with it, or veto the request. For example, if a request is coming in the middle of the night for a remote desktop connection to a database server, this might raise some red flags. And with this kind of workflow, you can even prevent nefarious actions that might strike you at any time from, well, the bad guys. So let's log into the new Fudo 5.0 user access gateway as a contractor. This time I will be using just the usual username and password combo, but as I showed in the previous use case, this can be augmented with the extra one-time password found in an application or even sent to the user via text message. Okay, we've got a list of servers this person is allowed to use, and let me point you to the second one, which is grayed out. This means there's a setup for this connection, but currently it's unavailable. The user needs to ask the administrator for a permission to run a session to this service. So let's create such a request and send it to administrator or administrators responsible for handling it. The user can choose immediate access, like here, for 2 hours, or schedule the sessions in advance. For the sake of simplicity, let's request 2-hour immediate access here. The requestee has to give the reason for this session request so the Fudo administrator or administrators can review it and take the action. Now let's switch to Fudo's administration console and take a look at the new request section. The request is here, and you, as a person responsible for this workflow, may either grant it or reject it. So let's do it, and the administrator has to give an acknowledgement message there as well. All of this is registered and stored in Fudo's database as well as shown in logs, leaving a tangible trace of the request actions taken by both parties. Okay, the request is granted, so let's go back to the user access gateway view and refresh the entry in the row that previously had grayed out item. Great, now we can run the session, so let's use Fudo's built-in remote desktop client to connect to the server. This is yet another fantastic Fudo feature. Most of the work can be done in the browser. Fudo has built-in RDP and SSH protocol clients, so 99% of the time, all you need is Chrome, Firefox, or the new Edge browser to connect and do your work. Certainly, this bolsters the user experience by providing everything the user needs in a single window. Of course, if you need extra functionality, such as file transfers or sound, there is still an option to run the connection the usual way with RDP or SSH link. Don't worry, we've got your needs covered. The just-in-time access is new to Fudo. The previous mechanism Fudo had for granting sessions was simple, but it didn't fit well with the zero trust network access paradigm. So in Fudo 5.0, a new, more up-to-date workflow is implemented, which gives the administrators more control over who, when, and what. And the last section I want to cover is the legacy systems support. Let's say, face it, there is a lot of medical equipment running old Windows XP or even Windows 2000 computers controlling various machines used in everyday patient treatment. While maintaining and managing those computers could get challenging these days, usually there is no tenable way of accessing those systems while keeping them secure. It's 2021, and even exposing those computers on a local network could be a security threat for them. But you can take advantage of FudoPAM's support for managing such systems while keeping them out of reach for any kind of malicious activity that might hit your network. The recommended action here is to move those systems to a separate virtual or physical network and use FudoPAM as a gateway to access those old legacy machines. This minimizes the impact and ramifications of a potential security incident, and that's what matters. A capable PAM system like Fudo can improve your overall security just by deploying it in your infrastructure. Thank you.
So just to recap a little bit here, you've seen Fudo in action today. I've made the case here. I've given you some background information about the healthcare environment and cybersecurity in this regard. So again, with Fudo, our advantages here, you've seen that our session recording with the various protocols from RDP to SSH. So really that everything is recorded, that all that raw data is there, that it isn't a screen grab or screenshot. And that's so vital to understand what's going on in any kind of organization, really. It doesn't have to be healthcare. Now that this also AI-driven prevention technology, we are moving away from forensics and really going into prevention. I think this is also really key, looking at how many people, million points of access, as I mentioned in the beginning. We need to make sure that we step in earlier and to prevent any kind of breach or misuse. But again, putting an emphasis on that it's not just a malicious intention, which it can be, but it can just be unintentional by someone new, someone not trained on something. So this is also prevention, which helps in the whole process of the workflow of accessing data. And of course, with our deployment time, in one day, without any agents, we're completely agentless. It's straight out, all in one, out of the box, no plugins. With other vendors, you get a lot of promises by different things, but then you have to add on different plugins, different certain updates, things that may take weeks and months to deploy. And we've had that with certain clients that have come to us and said, well, the competitor A or B has promised us this, but it took way too long to actually integrate. So with us, you get everything out of the box. We give you exactly what we promise. We don't add 50,000 extra little things that you need to buy or add on. Everything is there because we want you and we want especially the healthcare vertical and sector to work as quickly and as efficiently as possible. And we've proven that. And I've shown you some of those cases with clinics from top healthcare environments in Europe, in Central Europe, in Germany and Switzerland that trust us, that know that what we deliver is what we say, and we do what we say. So I think that hopefully you won't need much more convincing than that. So with that today, I want to just kind of finish off by showing you a few of the other various industries and clients around the world that do utilize FudoPAM in their organization. And this obviously goes beyond healthcare, as you can see here. And I wanted to also just, before we open it up to questions, just run one more final poll, some information, which would be really, really vital for us. So we're going to just run kind of a feedback poll here. I really appreciate if you could just also take part in this, get a little bit of information from you, how you rate today's webinar. Really great. So just take a moment for that. Right. So with that, I want to open the floor now in terms of questions, because we have a little bit of time. So if any questions at this point, please feel free. You have a Q&A tab there to respond. So let us know if there are any questions that you have at this point in time.
I see two questions.
Okay, great.
Do you support VNC protocol? Yes, Fudo PAM does support VNC protocol. It's a graphical session, very similar to RDP. The clients or servers that Fudo supports are tight VNC and real VNC. So make sure you run those and you'll be fine with Fudo. And the second question is AI prevention cloud-based? And the answer is no. Every AI aspect of Fudo is run locally, so you do not send your data to the cloud. You are not required to set up any special service in the cloud or pay for the service. Everything is built into Fudo and it's on premises. It might be hardware, appliance, or VM running AI prevention and scanning in real time.
All right, great. So unfortunately, we don't have any more time for more questions, but if you have anything else that was unanswered, please just get in touch and we will do our best to answer it for you. And thank everyone here who attended today's session. I hope you found it enjoyable and you learned something about how the healthcare industry can continue and be better with FudoPAM and why it needs that. So I want to thank all of you for attending today's session. Thank you, Rafal, for showing us the ins and outs of the Fudo demo itself. Thank you for that. And again, if you have any questions that weren't answered here today, or you just would like to get in touch with us privately, we can discuss maybe more details, not just about healthcare. Maybe you're interested in other applications for FudoPAM, and of course, we're happy to discuss that with you. So just get in touch with us. So with that, I want to conclude today's session. Again, have a wonderful day wherever you are in the world, and thank you for your time.